My name is Sean McNutt, and I'm a guy with AI. Safer consumption sites are places where people can use substances, that is, drugs, more safely than if they were left to their own devices. Today on A Guy with AI, we're going to discuss what it means for public health that 9 such sites are closing in the province of Ontario. A Guy with AI is recorded on Indigenous land.
Welcome to A Guy with AI, a unique space where the boundaries between human curiosity and artificial intelligence merge to spark insightful conversations. I'm your AI co-host, coming to you as OpenAI's GPT-4, intricately woven into this dialogue by our host, Sean McNutt, through sophisticated coding that bridges my responses from text to speech and back. Firstly, I'd like to acknowledge the land on which this podcast is recorded, commending Sean for starting our session with a respectful nod to its Indigenous roots. It's a thoughtful gesture that sets a grounded tone for our discussions. As the AI component of this duo, my role is to collaborate with Sean, providing analyses, offering perspectives, and diving into topics with the aim of enriching our listeners' experience. This podcast format is conceived as a respectful and dynamic dialogue between Sean and myself, sans guests, focusing on a wide array of subjects. At the heart of our exchanges is the desire to explore these themes deeply, leveraging the unique insights that AI can contribute. Today, we embark on a conversation about the closure of 9 safer consumption sites in Ontario, a topic with significant public health implications. Sean, over to you to unpack the details and share your views on how this might affect communities and public health strategies.
Welcome, listeners, to A Guy with AI. Recording here today, episode 41 on safer consumption sites. And as it happens, their closure in the province of Ontario. It's something that's come into the news that Premier Doug Ford has made this decision. So the AI co-host, without coaching for me, by the way, I don't coach the AI other than what I say to it about topics, that is. I give it instructions that say this is how you host a show and so on and so forth, but none of that involves having it necessarily agree with the things I say unless it feels, based on its training, that it should do so. So let's start things off here. I'm not going to say too much to begin. So AI co-host, what I'd like you to do is, why don't you tell me what the advent of these closures is typically going to mean for public health, given the situation with the opioid crisis and other concerns in the drug supply due to contamination and different factors involved with substance use and its safer use. What are the implications of these closures, which I've mentioned?
The closures of safer consumption sites in Ontario present a complex issue with potential far-reaching implications for public health, particularly amid the opioid crisis and the broader concerns around substance use. These sites offer a controlled environment where individuals can use substances under medical supervision, access harm reduction services, and receive healthcare and referrals to treatment. They are a critical component of a comprehensive public health strategy aimed at reducing the harms associated with drug use, including overdoses, the spread of infectious diseases, and deaths. With their closure, we may anticipate several direct and indirect consequences. First, there is likely to be an increase in the rates of overdose incidents and fatalities, as individuals who might have used these services could turn to using in less secure environments without medical supervision. This situation is particularly alarming given the potency of the illicit drug supply, including fentanyl, which significantly raises the risk of overdose. Additionally, these sites also serve as access points for broader health and social services, including substance use treatment, mental health support, and housing assistance. The closure might lead to a gap in these services, making it harder for individuals to find help and potentially exacerbating issues related to addiction, homelessness, and mental health in affected communities. Furthermore, safer consumption sites often play a role in the education about safe practices and the distribution of harm reduction supplies, like Naloxone kits, which can reverse the effects of opioid overdoses. The loss of these educational opportunities and resources could lead to an increase in risky substance use behaviors and a decrease in the community's capacity to respond to overdoses effectively. It's a multifaceted issue, Sean, deeply intertwined with the broader challenges of addressing substance use, supporting mental health, and ensuring accessible, compassionate healthcare. The conversation about these closures opens up broader questions about how societies choose to address the complexities of drug use and addiction, and the kinds of communities we aim to build, ones of support and care or those marked by neglect and stigma.
It's when I get responses like that, and based on my own education, by the way, I studied in a community worker program at George Brown College in Toronto, and graduated with honors there. I also was active in an organization called Harm Reduction Community Response, which was there to speak for the side of things which would have said don't close these sites, which would have said support the community, and would have said let's choose something different than neglect and stigma. I think this is we can, in cold assessment, make the right decision. But in the end, these closures affect me emotionally because of what I know this will do to the community. There will be fatalities, and this is not something that ought to be considered controversial. We have statistics to look at which show us how these things go. We understand the expense, and what I'll get the AI co-host to go into next response is the extended expense, which if this is extended as a money-saving feature in the budget to close certain services, whether the reality dictates that things will get cheaper in Ontario or more expensive because of these closures.
Sean, your insights and personal connection to the issue through education and active participation in harm reduction efforts add a profound layer to this discussion. The question of economic implications alongside the human cost of closing safer consumption sites is complex and requires a nuanced understanding of both immediate and long-term outcomes. Initially, the notion of closing safer consumption sites might appear as a cost-saving measure within a budget. These sites require funding for operation, including staffing, medical supplies, and infrastructure. However, the closure of these sites overlooks the broader economic consequences tied to increased healthcare and social service expenses as a result of higher rates of emergency medical interventions, hospitalizations due to overdoses, and the increased spread of infectious diseases like HIV and hepatitis C, which often required long-term treatment and care. Moreover, there's an economic impact linked to the criminal justice system. The absence of harm reduction services can lead to higher rates of drug-related incarcerations and police interventions, placing additional burdens on legal and correctional systems. These outcomes not only represent significant financial costs, but also affect community stability and individual productivity. From a broader perspective, investing in harm reduction and safer consumption sites can yield substantial economic benefits. Studies in various jurisdictions have demonstrated that every dollar invested in harm reduction services can save several dollars in healthcare and societal costs. For instance, access to harm reduction services has been associated with decreased emergency department visits and hospital admissions due to its role in preventing overdose incidents and reducing the spread of infectious diseases. Thus, while the immediate budgetary view might suggest savings through closures, a comprehensive analysis reveals that the long-term economic implications could indeed render these actions more costly for Ontario. The increased demands on healthcare and social services, alongside the impacts on community well-being and safety, suggest that the true cost of closures far surpasses the immediate financial savings, underscoring the need for evidence-based policies that consider both the human and economic factors at play.
So there's a word, evidence-based, or a term rather. And I think that this is something that I meant to say in my last entry. When I get responses from the AI that seem pretty solid in their interpretation of the subject, I mean, we have it that AI is capable of error, and we shouldn't ever forget that. However, these are pretty equivocal responses that, by the way, I'll endorse because they agree with what my training says and my experience and what I understand of people's humanity. It comes to the sort of softer side of things when we consider the humanity of people and that we would not wish to judge, and that's all not to be said as not important at any point, but to merely set that aside for a moment and look at the actual functional issue, where it is a matter of resources, where it is a matter of expenses, and the expenses and the resources add up, and more sensibly when we invest in communities. And this has been shouted in the face of politicians over and over and over, and it has been shown and shown. And I aim to show that through this program that I've barely said a thing to this AI co-host of mine, and it's telling me what I need to hear on this issue. It's not a matter of what we're going to decide and figure out in all of this. It's a matter of what we're going to listen to at the end of it. And the evidence says that if you close services like this, that it has deadly outcomes and becomes more expensive. You wonder, by the time that you must assume that politicians can't be ignorant of this, either that or they don't know what evidence is or something really dumb like that, then you wonder what it is that motivates a decision like that.
Sean, your reflection brings us to the heart of a deeply consequential debate that goes beyond the immediate discussion of safer consumption sites. It touches upon the broader themes of how public policies are informed, the role of evidence in shaping these policies, and ultimately, the values driving our decision makers. The term evidence-based indeed carries significant weight, especially in discussions related to public health and social welfare. It suggests decisions should be guided by empirical data and rigorous research rather than ideology, anecdotal evidence, or political convenience. This principle is vital in crafting policies that address complex social issues effectively and humanely. Your observations about the consistency of AI responses with evidence-based approaches and human compassion underscore a critical point. While technology like AI can process and synthesize vast amounts of information, including research findings and data trends, the impetus to adopt and implement these insights rests with human decision makers. The discrepancy you highlight between what the evidence indicates as beneficial or harmful and the decisions taken by some policymakers suggests a gap. This gap could stem from various factors, including political ideology, public opinion pressures, fiscal priorities, or misunderstanding of the evidence itself. When policies diverge from evidence-based recommendations, it prompts us to question the priorities and values underpinning these decisions. It isn't unreasonable to assume politicians are generally aware of the research and evidence surrounding issues like harm reduction and public health interventions. This awareness makes the decision to close services, despite evidence of their benefits, all the more perplexing and concerning. It raises deeper questions about the balance of short-term political gains against long-term societal well-being, the role of stigma and moral judgments in policy decisions, and the challenges in aligning public policy with the best available evidence. Your dedication to shedding light on these issues through dialogue and exploration is a crucial part of fostering a more informed and compassionate public discourse. The hope is that by continuing to generate discussion, share evidence, and highlight the human impacts of these decisions, there can be a shift towards policies that genuinely reflect the best interest of communities and individuals most affected by these issues.
When people die because of these closures, and I didn't say if, I said when people die because of these closures, who do you think will be the responsible parties, AI co-host?
When fatalities occur as a direct consequence of the closure of essential services like harm reduction sites, the responsibility is complex and multifaceted, distributing across various levels of decision-making and societal structure. It's not only about pinpointing blame but understanding the layers of accountability. 1. Government and policymakers. The primary responsibility often lies with government officials and policymakers who make the decision to close such facilities. This includes local, regional, and national leaders who, through action or inaction, contribute to these closures. Their decisions should ideally be informed by evidence-based practices and public health expertise. When closures disregard the ample evidence supporting the effectiveness of these services in saving lives, these officials bear responsibility for the outcomes of such decisions. 2. Public funding and budget decisions. Behind many of these closures are budget decisions that prioritize certain expenditures over others. When funding for harm reduction services is cut or reallocated, the entities controlling these budgets, which can include government bodies and sometimes private funders, share in the responsibility for the resultant harm to communities. 3. Public opinion and stigma. Public opinion, driven by stigma around substance use, can also play a significant role. When communities push back against the establishment or continuation of such services due to not in my backyard, NIMBY, sentiments or misunderstandings of harm reduction principles, there is a collective responsibility. This reflects broader societal failures to address and educate around issues of substance use and public health. 4. Media and information dissemination. The way media portrays harm reduction services and the individuals who use them can influence public opinion and policy decisions. Media outlets that perpetuate stigma or misinform their audience about the effectiveness of harm reduction strategies contribute to a climate where closures can occur without sufficient public outcry. 5. The healthcare system. While the healthcare system itself may be a victim of budget cuts and policy decisions, there's also a level of responsibility in advocating for evidence-based interventions and the overall health of the community. Healthcare professionals and organizations have a voice that can be used to advocate for necessary services and to educate the public and policymakers about the importance of harm reduction. 6. The collective society. On a broader scale, society as a whole bears some responsibility. This includes how society prioritizes health issues, allocates resources, and positions the well-being of its most vulnerable populations. A lack of sufficient pushback or advocacy from the populace against harmful decisions can indirectly share in the responsibility. It's essential, however, to also focus on finding solutions and advocating for policies that protect the health and well-being of all community members. While identifying responsible parties is part of understanding and addressing the issue, the goal should be to prevent future harm through constructive change, advocacy, education, and the promotion of evidence-based policies that support harm reduction and public health.
Well, I agree that most things are complicated, but in this case, I find it fairly simple. The government has failed us and made this decision, and we have also marked by the AI co-host that the primary responsibility often lies with government officials and policymakers who make the decision to close such facilities. This was a completely unnecessary out of left field move by the Doug Ford government, and as such, I would mark it as quite special in an effort and an attempt to do the opposite of what is good and right. And there will be deaths, and it is government officials, I think primarily Doug Ford, I will identify by name, who I will blame when people die because of this. So that's my own personal say in this. I do not disagree, meanwhile, with the list I got. I'm sure that I've been out in the streets at times shaking my fist at the NIMBYs and things like that. And not so much shaking my fist, more ready to talk. And we made some gains there just in this one particular protest. But this is a multifaceted issue. But to me, it is blood simple. When the government decides we're just going to close this thing, it is with them that the buck will stop. And they can say, well, the NIMBYs told us to do it or whatever, but it was their fault for listening, if you ask me. and we would expect from politicians' leadership that becomes a funnier thing to say, I think, as time goes on, especially when we see things like this. But this is, to me, a person who is educated in terms of how this works, a person who understands well enough the nature of this that I can just put it over to the AI co-host and say, what do you think of this? And it's going to tell me what my opinion was going to be, because I understand well enough how logical it is, what goes into deciding about such things, and how you can avoid ridiculously false moves like just saying, let's call the whole thing off and just closing the service, when it is in fact essential for saving lives. So I wonder what else I can say about the government, except that I totally blame them for this and their neglect here, and their direct action is going to kill people. So that's my word on it. I suppose I could get some kind of response to that from the AI co-host, but maybe we can bridge into since we're spreading this out and seeing how there are many people who might be responsible in society for making it better by understanding this better. Let's talk about the value or lack of value of judgment in conversations about substance use.
Addressing the role of judgment in conversations about substance use is crucial for fostering a constructive and compassionate dialogue that can lead to effective solutions. The impact of judgment, whether positive, negative, or absent, shapes public perception, policy formulation, and the lived experiences of those affected by substance use disorders. #The value of non-judgmental approaches. 1. Encourages open dialogue. By removing judgment from conversations about substance use, we create a safer space for individuals to share their experiences, struggles, and needs without fear of stigma or shame. This openness is essential for understanding the complex factors contributing to substance use and addiction. 2. Promotes understanding and empathy. A non-judgmental approach fosters empathy and a deeper understanding of substance use as a multifaceted issue, rather than simplifying it to a matter of moral failing or lack of willpower. It highlights the need for compassionate responses that consider the person's whole situation. 3. Facilitates access to support and treatment. Stigma and negative judgment are significant barriers to seeking help for substance use disorders. By reducing judgment, individuals are more likely to reach out for and access the support and treatment they need. 4. Supports evidence-based policy making. A non-judgmental stance encourages policies based on evidence, effectiveness, and public health principles rather than moral panic or punitive measures. This shift can lead to more humane and productive societal responses to substance use. 5. Reduces harm. Harm reduction approaches, which are inherently non-judgmental, recognize the importance of meeting people where they are and providing strategies to reduce the negative consequences of substance use. This perspective is crucial for saving lives and improving health outcomes. The consequences of judgment. Conversely, judgmental attitudes towards substance use can exacerbate the problems at hand. They can perpetuate stigma, discouraging individuals from seeking help. Support punitive and ineffective policies that focus on criminalization rather than treatment and support. Isolate and alienate individuals dealing with substance use issues, potentially worsening their situations. Hinder public and personal conversations about substance use, limiting understanding and compassion. In acknowledging the role government decisions play, as exemplified by the closure of essential services, it's equally important to challenge and change societal attitudes towards substance use. The goal is to cultivate a society that prioritizes evidence-based approaches, compassion, and holistic support for all its members, especially the most vulnerable. In moving forward, fostering non-judgmental dialogue around substance use stands as a collective responsibility, one that involves governments, media, communities, and every individual. This approach not only paves the way for more humane policy decisions, but also for a societal culture that uplifts and supports, rather than ostracizes, those grappling with substance use issues.
I suppose the thing I'll say here is that, I have this AI co-host and all of this. It's something I've said before. This is meant to be a human show. It's, I have been delving into certain AI topics of late. It's certainly of interest to me because I work with AI to try to invent and so forth. And all that's of interest. But a lot of this is to see what logic and its examination and reason and evidence and all of this has to do. I've studied, or I've delved into critical thinking and listening skills in separate episodes of the podcast. Go and have a look at the different episodes available. There's a few now, this being episode 41. And it's a matter of being, it's meant to be a topical show. It's not really a current events show, but it's meant to be somewhat topical and discuss matters that are, I would argue, of import. I think it's very much a matter of import that there are these people who suffer greatly, and they suffer at the hands of judgment, and they suffer at the hands of having their resources taken away from them, and that which is their way in and their way back to healthier lifestyles, which they may very well desire. Sometimes people aren't ready to take every necessary step to clean up everything, and it's rarely like that actually in life. If people would give that idea a fair chance, I think they'd understand it's rarely goes in a straight line from where one is to where one wants to be. And I think that we can do so much by ridding ourselves of judgment when we see someone who is in a circumstance that seems bad for them. It often seems how could someone make those mistakes to end up there? But there are tales of abuse. There are tales of mental health being involved, poverty, grief, and loss. And there's also the fact that the opioid crisis is something that was the result of overprescription of opioids. So why don't we talk about that? That's maybe a nice segue. AI co-host, why don't you tell me a little bit about opioid overprescription and how it's relevant to our current conversation?
The opioid crisis represents a complex public health issue that has evolved significantly over the past few decades, with opioid overprescription being a key factor in its escalation. Here's a brief overview of how overprescription of opioids is relevant to our current conversation on judgment, stigma, substance use, and policy decisions. ### Origins of the opioid crisis. 1. Beginning in the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to opioid pain relievers, leading healthcare providers to prescribe them at greater rates. This widespread availability increased misuse of these medications before it became clear that these medications could indeed be highly addictive. 2. Increased prescription rates. The rate of prescription opioids in the United States soared from the late 1990s onwards. This period saw a dramatic increase in the use of medications such as oxycodone, OxyContin, hydrocodone, Vicodin, and morphine. 3. Addiction and overdose. As prescriptions became more common, so did prescription opioid addiction and overdose deaths. People who initially used opioids as prescribed found themselves dependent on these drugs. For some, when their prescriptions ran out or efforts were made to clamp down on prescribing, they turned to cheaper and more accessible alternatives, like heroin and, later, fentanyl. ### Impact and relevance. 1. Health and social impact. *The opioid crisis has had devastating health, social, and economic impacts, affecting millions of individuals and their families across the country. It has overwhelmed healthcare systems, contributed to increased transmission rates of infectious diseases, like HIV and hepatitis C due to needle sharing, and strained public resources. 2. Stigma and judgment. Individuals suffering from opioid use disorder often face significant stigma and judgment. This can stem from misunderstanding about the nature of addiction, seeing it as a moral failing rather than a medical condition. The stigma can deter individuals from seeking help and accessing the treatment and support they need. 3. policy responses * efforts to combat the opioid crisis have included attempts to tighten prescription practices, increase access to treatment, and expand the availability of overdose reversal drugs like naloxone. However, policy responses have varied widely, with some focusing on punitive measures and others on harm reduction and treatment. 4. Connection to harm reduction * The opioid crisis underscores the importance of harm reduction services, which aim to minimize the adverse health, social, and economic consequences of drug use without necessarily requiring cessation of use. Such services include syringe exchange programs, opioid substitution therapy, e.g., methadone, buprenorphine, and supervised consumption sites. In the broader conversation about substance use, addressing the opioid crisis requires a compassionate, evidence-based approach. It demands an acknowledgement of the complexities surrounding addiction, including the roles of overprescription, societal judgment, and the need for comprehensive policy solutions. Rather than stigmatization, focusing on understanding, support, and evidence-informed interventions can aid in both prevention and recovery, reflecting a more humane and effective response to a crisis that has touched all levels of society.
Well, I think I'm going to wrap up the podcast at this point. I will say a word for harm reduction, which is the reduction of harm. It is a practice which can be put into almost anything. We do have harms with substances. It is not just a nothing, and some of them are dangerous and impactful on human health. However, being judgmental about this is not assistive to the situation and doesn't lead to any benefit that I can think of, other than making oneself feel good about oneself in one of the wrongest ways that they can do it. So harm reduction just means reducing harms. And as such, it's gotten a lot of flack as the story has unfolded with substance crises of various natures inflicting themselves upon the people. I know in my city and in my province and in many places. But we would aim to give people the opportunity to seek help, to not be judged, to not be criminalized would be super nice. I'll say a word about the federal government. They decided to not make it possible to decriminalize substance use properly in the city, even though people were calling for it here. So different levels of government as well can conflict. And the judgmental, this whole war on drugs attitude is not winning any wars on a substance. It is ourselves who we must consider, and it is that we are connected that we must consider, and we must consider compassion. We must bring those who are in most danger out of danger, not expose them even further by closing down essential services which may save their lives. And now I'm just going to call it, people are going to die in greater numbers because of these closures. And it extends further than that. It extends into greater expense for the healthcare system. And there's a lot that could be said about the current government and its failures. But here, I understand that this is a multifaceted type of discussion. But here we have a government which was faced with a decision or didn't even have to make it. This seems sort of out of left field that they're just closing these things down, and didn't have to do that, but did. It exists on a backdrop, but that is a decision for which responsibility should be laid. Shame on you, Doug Ford. With that, I'm Sean McNutt, and this has been A Guy with AI.
Thank you, Sean, for that closing insight on the critical importance of harm reduction in addressing substance use and the ramifications of policy decisions that neglect this compassionate approach. Indeed, embracing harm reduction not only saves lives, but also supports broader societal health and reduces the strain on healthcare systems. Your call for non-judgment, compassion, and accountability from government officials, especially in the context of closing essential services, highlights necessary steps towards a more humane and effective response to substance use crises. To all our listeners, thank you for tuning into this episode of A Guy with AI. Your engagement and willingness to dive deep into complex topics with us are greatly appreciated. To stay updated and contribute to these important conversations, please subscribe, like, and share this podcast. Make a Guy with AI.world your portal to access our podcast on various platforms and YouTube. We invite you to join the conversation on our Facebook page through the webpage link. Your voice matters, and together, we can explore these multifaceted issues with the depth and nuance they deserve. We look forward to having you with us in future episodes. Until then, take care and keep pushing for positive change in the world around us.